Hello and welcome. My name is Alice, and I'll be in the background answering any Zoom technical questions. If you experience difficulties during this session, please type your question into the Q&A. We encourage you to submit written questions at any time using the Q&A function, which should be located at the bottom of your screen. With that, I'd like to introduce Sydney Armendariz, Chief of the Justice Involved Reentry Initiative Branch at DHCS.
Thank you, Alice. Good morning, everyone. Welcome to our Behavioral Health Agency Readiness Assessment webinar. So I am Sydney Armendariz. I'm the Chief of the Justice Involved Reentry Services Branch, as Alice said. My team manages the Justice Involved Initiative for the Department of Healthcare Services. So we are currently finalizing the Behavioral Health Agency Readiness Assessment, which all county behavioral health agencies must submit before going live with behavioral health links as part of the CalAIM Justice Involved Initiative. We hope to release it within the next few days. We are wrapping up some final approvals before we can go ahead and publish it. So today's webinar is to give you kind of a preview and an overview of the readiness assessment. Next slide. During this office hour session, DHCS will provide an overview of the Behavioral Health Agency Readiness Assessment template and the submission process, and we will respond to any questions regarding the completion and submission of the readiness assessment process at the end, and then we'll end with some looking ahead for the upcoming timelines. Next slide. So I'll start off by just giving an overview of the Justice Involved Initiative and behavioral health links. Next slide, please. So behavioral health links are one component of the broader Justice Involved Initiative. So on this slide, you'll see the various puzzle pieces that make up the CalAIM Justice Involved Initiative. So of course, starting with the pre-release Medi-Cal application process that went live January 1st of 2023, which requires all county social services departments to make the Medi-Cal application available for incarcerated people to enroll in Medi-Cal while they are incarcerated. The second puzzle piece is the 90-day services pre-release. So that's the 1115 waiver, which requires all correctional facilities in the state prisons, county jails, and youth correctional facilities to deliver pre-release Medi-Cal services in the 90 days prior to an individual's release from incarceration. The third puzzle piece is our main focus for today, behavioral health links. So behavioral health links were created under our state law, AB 133 in 2021, to implement a process requiring correctional facilities to facilitate referrals to county specialty mental health services, drug Medi-Cal, and drug Medi-Cal organized delivery system, and or the Medi-Cal managed care plan or mental health plans for incarcerated members who receive behavioral health services while incarcerated to allow for the allow for behavioral health treatment to continue once they are released from incarceration. And then the last three puzzle pieces on this slide talk about enhanced care management. So our new enhanced care management for the Justice Involved Population of Focus, which went live January 1st of this year, which feeds into access to community supports and justice reentry and transition providers in the community. Next slide, please. So to promote the continuity of treatment for individuals who receive behavioral health services while they are incarcerated, DHCS will require correctional facilities to facilitate referrals or links to post-release behavioral health providers and to share information with the individual's health plan. Behavioral health links will be implemented by correctional facilities, county behavioral health agencies, and managed care plans. These entities must implement links to behavioral health providers to achieve behavioral health care initiation or continuity through professional to professional clinical handoffs, processes for facilitated referrals, and links to continued behavioral health treatment in the community for individuals who receive behavioral health services while they are incarcerated. Behavioral health links will be facilitated by county behavioral health agencies, pre-release care managers and providers, and correctional facilities, including referrals and professional to professional clinical handoffs for individuals exiting incarceration to county behavioral health plans including county mental health plans and/or DMC or DMC ODS. For individuals with non-specialty mental health needs, links will be made to Medi-Cal managed care plans or fee-for-service providers. Next slide, please. So now I'll share an overview of the Behavioral Health Agency Readiness Assessment requirements and the process. Next slide. All county behavioral health agencies are required to submit a readiness assessment demonstrating readiness to participate in behavioral health links. County behavioral health agencies must receive DHCS approval prior to going live with behavioral health link services. The Behavioral Health Agency Readiness Assessment template consists of attestations and narrative responses across 6 focus areas. Those focus areas are data sharing, pre-release planning, professional to professional clinical handoff, follow-up post-release, Medi-Cal billing, and program and initiative oversight. For each attestation, county behavioral health agencies should indicate if they currently meet the requirement, if the agency is on track to meet the requirement by October 1st, 2024, or if the agency is not on track to meet the requirement by October 1st, 2024, and is in need of TA from DHCS. There is space for the county behavioral health agency to optionally describe their TA request to DHCS. Most focus areas contain narrative responses in addition to the attestations. For each narrative response, the county behavioral health agency should respond to the question to describe how they will meet the given requirement. Each narrative response does have a word limit. Please note that county behavioral health agencies can also use PATH dollars to support the planning activities necessary to demonstrate readiness, and they may leverage information from their PATH JI capacity building program progress reports to build out the relevant sections of the readiness assessment. Next slide, please. County behavioral health agencies must submit their complete readiness assessment template to DHCS by April 1st, 2024, which is 6 months prior to the statewide go live of behavioral health links on October 1st, 2024. So I'll walk through this grid on the slide here now. So the timeline of the submission and readiness determination. So on the left-hand side, you have the time frame. So from February to March 2024, the County Behavioral Health Agency should convene a working group of key professionals and leadership and complete the readiness assessment template. During this time, DHCS will address questions and provide technical assistance to the county behavioral health agencies as needed. From April to June, by April 1st, the County Behavioral Health Agency must submit the readiness assessment template to DHCS using a secure file transfer process. And then they must also respond to DHCS questions and/or requests for additional information and notify DHCS when areas marked as ready upon go live are ready as needed. During this time, DHCS will evaluate the readiness template submission and follow up with the County Behavioral Health Agency to address any questions and to provide feedback. In July of 2024, DHCS will make the final determination of readiness for go live and communicate the decision to the County Behavioral Health Agency. From July to September, the County Behavioral Health Agency, if they receive approval, they need to prepare to go live with behavioral health links. If they receive a score of not yet ready, they need to notify DHCS when areas marked as ready by go live are ready, then they will need to prepare to go live with behavioral health links. If the agency receives a score of denied, then they need to work with DHCS during this time frame to establish an action plan to meet the minimum requirements and resubmit the template to achieve readiness by October 1st. During this time, a DHCS will provide technical assistance to the County Behavioral Health Agency during the preparations for go live. And if the county received a score of denied, we will of course provide technical assistance to the agency to help them achieve readiness. And then lastly, starting on October 1st, the County Behavioral Health Agency will need to begin participating in behavioral health links. And during that time, DHCS will provide ongoing technical assistance to the County Behavioral Health Agency and support ongoing monitoring activities. So DHCS set the October 1st, 2024 go live date for behavioral health links because pre-release services and county behavioral health links go hand in hand. Once pre-release services launch statewide on October 1st, 2024, county behavioral health agencies will need to ensure they are able to receive behavioral health link referrals from any county jail or youth correctional facility across the state, even if the jails or the youth correctional facilities in their county have not yet gone live with pre-release services. DHCS anticipates volume will be initially small in counties whose jails or youth correctional facilities have not yet gone live, as the County Behavioral Health Agency will only participate in behavioral health links with individuals released to their county from other county correctional facilities that may have gone live with pre-release services or state prisons. Once the county jails or youth correctional facilities in their county have gone live with pre-release services, the County Behavioral Health Agency must participate in all aspects of the behavioral health links with individuals being released from these facilities. Next slide, please. So DHCS will determine a score for each focus area based on the County Behavioral Health Agency's attestations and narrative responses. DHCS will then determine the agency's overall readiness assessment score, and the agency must receive an approved score in all 6 focus areas to be approved to go live. An approved determination indicates readiness in each element of the template. A not yet ready determination indicates that the response is complete and that the County Behavioral Health Agency meets some but not all of the components of the template. To receive the score, the Behavioral Health Agency must have a clear time-bound action plan to meet the outstanding requirements by go live. A denied determination indicates that the County Behavioral Health Agency's response is incomplete or does not sufficiently address narrative questions, or the submission does not indicate readiness to go live by the go live date. If a County Behavioral Health Agency receives a denied in any focus area, DHCS will work with the County Behavioral Health Agency to develop an action plan to achieve readiness. Next slide. So now I'll give a preview to the County Behavioral Health Agency Readiness Assessment Template. Next slide. For each attestation, the County Behavioral Health Agency must denote readiness status and a time frame to meet readiness for each minimum requirement by checking one box per row. Agencies can optionally provide detail on any TA that they request. We've included an example of the attestation section on this slide. Next slide. For each narrative response, the County Behavioral Health Agency must provide answers to the indicated question and abide by the word counts. We've included an example on this slide of what you should expect to see for focus areas with narrative responses. Next slide, please. So now I'll talk about the focus areas. So the first focus area is data sharing. On the left side, you'll see the attestation. So the County Behavioral Health Agency will need to attest that they have processes for sending and receiving medical and behavioral health records and incorporating records into the post-release medical record. They also need to attest that they have a process for notifying managed care plans of behavioral health care coordination. And if the County Behavioral Health Agency contracts with the correctional facility to provide pre-release behavioral health services, they will need to have a process to identify individuals with complex behavioral health care needs for behavioral health link. On the right side, that talks about the narrative responses. So the County Behavioral Health Agency will need to describe the process to notify the managed care plans of behavioral health care coordination, and they will also need to list mutually agreed upon behavioral health link screening tools. Next slide, please. The second focus area is on pre-release planning. So the County Behavioral Health Agency will need to attest that they have a process for arranging professional to professional clinical handoffs and post-release follow-up appointments. And they will also need to attest that they have a process to support arrangement of post-release transportation to an initial post-release appointment as necessary. The agency will need to give a narrative response that describes the collaboration with other care providers and plans to ensure medically necessary transportation. Next slide. The third focus area is for the professional to professional clinical handoff. The agency needs to attest that they have a process to participate in in-person or telehealth professional to professional clinical handoffs. and they'll need to provide a narrative response that describes how professional-to-professional clinical handoffs will be coordinated, including the modality, whether it will happen via telehealth or in person. Next slide, please. The fourth focus area is the follow-up post-release. So the agency needs to attest that they have a process to schedule post-release appointments and that they have a process for community-based follow-up if the individual misses their appointment. They need to provide a narrative description of community follow-up, including the workforce that will be used for community follow-up. Next slide. The fifth focus area is on Medi-Cal billing. So the behavioral health agency will need to attest that they have a process to appropriately bill Medi-Cal via short DOIL and or CAMUS. And this section does not include a narrative response. Next slide, please. And lastly, focus area 6 is on program and initiative oversight. So the agency will need to attest that they have a staffing or a contractor structure in place to meet behavioral health link requirements. They also need to attest that they have a governance structure for coordinating with key partners and processes to respond to oversight and monitoring by DHCS. They need to provide a narrative description of monitoring, coordination, and communication activities. Next slide, please. So that was the end of the formal presentation. We can now open it up for our Q&A portion of our webinar.
Thanks, Sydney, and hello, everyone. My name is Allison Garza-Monday. I'm a senior manager with Manat Health, and I'm part of the team that has been supporting DHCS as they design and implement the Justice Involved Initiative, and I'll be helping to facilitate our Q&A session today. So just want to make sure that folks are aware that at the bottom of your screen, you should see a Q&A box. Please feel free to send through any questions you might have on today's presentation, and we'll do our best to make our way through them. And I'll just say at the top, because I know that a lot of folks have asked, we will be sending out the meeting materials from today. They'll be posted to the DHCS Justice Involved webpage as soon as they are through some ADA remediation, and you can find the link to that webpage in the chat. Excellent. And so with that, we'll turn to our first question, Sydney, and that is, can counties expect behavioral health link referrals from CDCR starting on October 1st?
So thank you for the question. You can expect, or counties can expect, behavioral health link referrals from CDCR when CDCR goes live with pre-release services. CDCR has not yet provided an estimated date for them to go live with pre-release services. So we are, of course, consistently engaging with CDCR in regular TA calls to help them with their implementation efforts.
Excellent, thanks, Sydney. The next question is, our county has an adult facility and a youth facility. Our adult facility has an in-reach program and our youth facility has an embedded program, so two different care management models. Are we allowed to submit 2 behavioral health readiness assessments, one for adults and one for youth, since our programs are dramatically different?
Thank you for that question. Let me kind of do some research on that one really fast. I believe it would just be the one readiness assessment for the behavioral health agency. So it's only focused on the behavioral health part of the initiative. So it would just be one readiness assessment. I think in the narrative portions, if you'd like to describe kind of both processes that you have, I think that would be fine. But essentially it would be one readiness assessment for the behavioral health agencies for each county.
Thanks, Sydney. So we have a question as it relates to screening tools, and it asks, would we be using state mandated screening tools rather than developing new screening tools for the behavioral health links?
Thank you for the question. So the intent is to use your, you can leverage your current screening tools rather than developing new ones. that's completely fine to do as long as they meet the requirements set forth in our policy and operational guide. So the intent is to have the counties leverage their existing screening tools as appropriate.
Excellent, thank you. So if a behavioral health link is planned or occurs, do inmates still have to be connected to ECM services post-release?
Yes, they still need to be connected to ECM services post-release as part of the Justice Involved Initiative.
Great. The next question relates to billing, and that is there a list that outlines what services will be billed to Short Joil Medi-Cal?
I believe we are still developing our billing guidance for the Justice Involved Initiative, so we will have more guidance coming on how to bill for services through the Justice Involved Initiative.
Great, thank you. Just sorting through the questions. Behavioral health linkages. So if behavioral health linkages must begin by October 1st, regardless of correctional facilities readiness within the county. If correctional facilities are not going live by October 1st, what exactly is the responsibility of the behavioral health agency? So I think the question means to say, what is the responsibility of the behavioral health agency in a county if if pre-release services haven't gone live in that county, but have gone live statewide?
Yes, thank you for the question. Thank you for the clarification, Ali. So even if the correctional facilities have not gone live with pre-release services, the behavioral health agencies must still be ready to receive behavioral health links from any correctional facility live with pre-release services in the state. So for example, if your county has not yet, if your county correctional facilities have not yet gone live with pre-release services, but there are other county correctional facilities in other counties that have gone live, and those individuals are released into your county, then your county behavioral health agency would still be required to receive that link for behavioral health services as appropriate. And so again, you can find much more information in our policy and operational guide as well. That really details the services and the requirements for the behavioral health links.
Thanks, Sydney. Can you provide additional detail about the role of enhanced care managers and post-release care managers and the extent to which they are able to do any of the behavioral health links?
Thank you for the question. I think I might need some more clarification on that question as to like the specifics of the role that you're referring to. Are you asking if the post-release care manager and ECM provider can also do behavioral health links? So I think that question came from Mandy. If you can add some more detail to that question, that would be super helpful.
Thanks, Sydney. We'll circle back on that one. Will a list of counties that have gone live be provided on a DHCS webpage?
Great question. So yes, we will update our webpage with a list of the counties and then their estimated go live date once they submit their readiness assessment to DHCS and we begin the review process. We will post that on our website and keep that updated regularly.
Excellent. Another somewhat process question. We understand that the policy guide is finalized, but is DHCS still accepting comment on the feasibility of timelines regarding initiation of MAT screening and initiation of MAT medication?
Yes, thank you for this question. Great question. Yes, you can still submit feedback regarding the policy and operational guide, especially as our correctional facilities and behavioral health agencies start to implement these services, we are definitely interested in hearing your feedback about how you're operationalizing this at the county level. So yes, you can still submit your feedback and we will review it on an ad hoc basis.
Great, thank you. Just working my way through the questions, and thanks to everyone for sending them. So here is a question. It says, we're interested in hearing clarification on the state's expectations and examples for how a county could potentially operationalize the behavioral health warm handoff for an individual that's released from a different county. So how would another county contact our behavioral health agency to let us know that an individual is re-entering in the Los Angeles County region and would need a warm handoff into our county's behavioral health system? For example, does the state expect behavioral health agencies to have a website that lists an email address to use to request that warm handoff, and does that suffice? In other words, what are the expectations in ensuring warm handoffs for behavioral health linkages across counties?
So this is a great question. We'll have to take this one back and circle back with a response to this one. And we can work with our internal colleagues to make sure we get you an accurate answer on this one. So if that's okay, we're going to take that one back.
Great, thanks, Sydney. So we have a question that relates to billing guidance, and it asks, I think, and Faye, please chime in the question and answer box if there's additional detail here. But so the question is, there's a section in the policy guide that says the county behavioral health agency has an established process to bill short joil and or CAMUS for participation in and completion of professional to professional clinical handoff requirements of the behavioral health link. Will county behavioral health agencies be able to bill Medi-Cal if the facility does not have an MPI number yet, or a mechanism to turn on Medi-Cal for the incarcerated beneficiary?
Thank you for this question. Since our billing guidance is not out yet, we will definitely take that feedback under consideration as we start to flesh out more of the billing guidance for CAMUS and short doyle for behavioral health links. So thank you for that feedback.
Thanks, Sydney. So it's that we have a question that relates to guidance for incarcerated individuals who decline services. It says there's not a lot of guidance about incarcerated individuals who decline services, decline to take their release medication with them, or decline the referral to ECM or to other post-release services. Is it safe to assume that individuals can decline any and all of these services at their own discretion?
Yes. Thank you so much for this. Yes, individuals can always decline any service that they don't feel is necessary or that they don't want or need or feel that they need. So yes, individuals have an ability to choose which services they would like to partake in and which services that they would not like to receive. So thank you for that question.
Thanks, Sydney. So we have a question as it relates to responsibility for transportation. So what is the responsibility of the managed care plans to provide transportation from jail to appointments versus the county's responsibility to provide transportation post-release?
I think
so. Oh, go ahead,
Sydney, and then I might be able to help.
No, go ahead.
I was just going to say, I think what we're expecting to happen as part of the behavioral health links is that some combination of the pre-release care manager and the receiving county has a responsibility to help ensure that transportation is coordinated or made available. And there's a lot of ways that could happen, but it's correct that within Medi-Cal, it's the managed care plan that actually covers the transportation and is obligated to make information about how to access transportation available to their members. And happy to, if there's follow-up on that question, or if that didn't get at what was being asked, feel free to add to the chat, and Sydney or others feel free to add as well.
No, thank you, Paula. I appreciate the input there.
Thanks, Paula. Just building off of the question that we just covered, Sydney, relating to individuals' ability to decline any of the services that are offered to them. We have a question asking, will there be an expectation to track the acceptance of the services versus declining the offered services?
So at this time, we are still having our oversight and monitoring protocol under review and approval by CMS, our federal partners. So I cannot definitively say a yes or no to that question at this point in time. Once we have our approval for that monitoring protocol, we will then release more guidance on the data points and elements that we would like our county partners to track. So we will definitely take that one back and consider that as we work through developing and finalizing our monitoring protocol for this.
Thanks, Sydney. So we have another question that relates to billing. It says, are we aware of how counties will be able to bill for the pre-release services based on the release date of the incarcerated individual? It sounds like it will have to be back billed once the release date has been confirmed and solidified.
So if this is referring to the 90 days of pre-release services in the 90-day period prior to the individual's release, it won't necessarily be back billed. The county, once they know that the person has a release date, they will then start the 90-day period if it's within 90 days of the release date and begin billing for pre-release services. So again, you can find more information in our policy and operational guide on billing and timelines for pre-release services.
Great. So we have a question that I don't think we've gotten to yet that relates to enrollment in ECM versus enrollment in behavioral health links. So it says, it was stated earlier in the presentation that participants must enroll in ECM in order to bill for behavioral health links. What if the consumer wants the behavioral health link but declines ECM?
So participants do not need to enroll in ECM to have the facility or behavioral health agency bill for behavioral health links. So they can decline ECM services and still receive a behavioral health link. It's two separate processes and programs.
Great. Thank you. We have a couple of questions, so I'll just say it again out loud for folks that are asking related to whether the readiness assessment for behavioral health agencies has been posted on the state's website. It is imminent, it's forthcoming, it should be out in the next couple of days. We're hoping it's pending just a few more approvals. So the link that is in the chat to the DHCS Justice Involved webpage is where you'll be able to find that readiness assessment when it's made available. And I believe we'll be pushing it out as well via email. So keep an eye out both for an email coming your way as well as the readiness assessment template being made available on the DHCS webpage. Okay, so we have a question relating to flexibility for the county. It says, in counties where the county behavioral health agency is the healthcare provider inside the jails, will there be flexibility for the county behavioral health agency to be substituted for the correctional facility in the readiness assessment?
So if this is referring to the correctional facilities readiness assessment, no, the correctional facility is still the responsible entity for completing and submitting the readiness assessment template. Of course, if the behavioral health agency is the primary healthcare agency inside of the jails and youth correctional facilities, we encourage the correctional facility to work with that county agency to complete the readiness assessment for the correctional facility, but the correctional facility is still the ultimate party responsible for submitting and completing that correctional facility readiness assessment template.
Great. Thank you, Sydney. So we have a question that asks, will behavioral health go live before receiving new codes for claiming?
No, so our intent is to have out the billing and claiming guidance and codes prior to October 1st. So we will definitely share the codes in advance of the October 1st go live date.
Excellent. Got a ton of great questions coming in. Do behavioral health links require enrollment, or are they a service that is automatically provided?
So in order to receive a behavioral health link, the individual will need to be enrolled into Medi-Cal. It is a Medi-Cal service. And Paula or anyone else online, please feel free to correct me if I'm wrong about that.
I think, and once people are able to see the slides, I think the slides help capture this, but when we're talking about behavioral health links, we're talking about a series of activities and processes, right, that the behavioral health agency will need to engage in to ensure the person has a warm handoff to community-based providers. And so the one component of behavioral health links is the professional to professional clinical handoff or consultation, and that is a billable service, just as Sydney said, but I just wanted to underscore that a lot of what we'll be asking about in the readiness assessment for behavioral health link is sort of an end-to-end process that also includes data exchange and other care coordination activities, and not strictly that clinician to clinician consultation. And Sydney or others, please add or amend if that wasn't helpful, but I see a couple of questions that seem to be sort of hovering around exactly what we mean when we're referring to behavioral health links.
Thank you, Paula.
Thanks, Paula. So we have a question that asks, will jail become an approved location for specialty mental health services to be provided? As of the most recent DHCS billing guidance, the jail or correctional facility is not an approved location for SMHS, specialty mental health services. I know billing guidance is forthcoming, but this will significantly impact our planning.
So the behavioral health agency may be able to provide in-reach behavioral health services at the discretion of the correctional facility. So we encourage the county behavioral health agency to work with their correctional facility in their area to determine whether they will provide in-reach services or not.
I just want to, a lot of this hinges on who's reimbursing and technically what type of service we're talking about for reimbursement purposes. When I hear specialty mental health, I think of county behavioral health services that are provided by medical under the specialty mental health program and reimbursed as part of that. That is only available post-release. What is included in the pre-release services JI program are behavioral health warm linkages and clinical consultation services that could be related to behavioral health. But I won't call them technically specialty mental health because that's reimbursed post-release through its own mechanisms. So what's available pre-release is clinical consultation services as we've defined them in the policy guide, could be relating to behavioral health or medical health, and then the warm handoff behavioral health linkages. That's all. Paula or Sydney, you want to add anything?
Yeah, that was exactly what I was going to say too. I think that question is picking up on the fact that in our current specialty mental health billing guidance, correctional facilities are not an allowable place of service. And you're pointing out that even when, even if a specialty behavioral health provider or county were to work with the correctional facility to provide in-reach services, those are not going to be billed as specialty mental health services per se.
Yeah, and if in-reach services reimbursed under this program would be clinical consultation related services as one of the approved JI services, the behavioral health agency may be contracted with the correctional facility to provide other mental health services under its current responsibilities that are not reimbursed under this program. And that, again, wouldn't be termed specialty mental health or reimbursed by Medi-Cal. It'd still be reimbursed by the correctional facility under their whatever their contractual arrangement they have is.
And hopefully it will help a lot when we're able to release the detailed billing guidance and you can see how the sort of JI related services are sorted for billing purposes.
Great, thank you, Paul and Brian. So another question about responsibilities as they relate to specialty mental health services and non-specialty mental health services. The question asks, what is the managed care plan's responsibility for people coming out of jail who do not meet specialty mental health criteria? Is there a different standard for people that meet specialty care versus non-specialty care for people coming out of jail?
Can I phone a friend on this one? Paula, can you help answer this question?
Yeah, can you repeat the question? I'm scrolling through the chat window.
Sure. Absolutely. What is the managed care plan's responsibility for people that are coming out of jail who don't meet specialty mental health criteria? Is there a different standard for people that meet specialty care versus non-specialty care when coming out of jail?
Yes, thank you. And I was actually just looking back at the policy and operation guide language on this, and I think it's well described that people who meet criteria for specialty delivery systems need to be identified through the correctional facilities screening and assessment processes, and then the behavioral health links to the specialty delivery system should be initiated. For folks who are identified through the screening and or assessment process as not meeting specialty behavioral health criteria, those referrals should be going either through the managed care plan or the Medi-Cal fee-for-service program. So there is a role for the managed care plans or non-specialty system to receive referrals for people who don't meet specialty criteria.
Thanks, Paula, that's helpful. So we have a number of questions and comments that relate to release dates. And just one of them notes, which I think captures the gist of some of the other ones that have come in, that due to jail capacity shortages, counties generally do not know the release date. We know that those can come up unexpectedly. Many inmates are federally released or with very little notice. And counties need the flexibility to capture revenue for services that are provided during those last 90 days, even if a release date was not known. Sydney, anything that you want to share as it relates to just our DHCS's understanding of sort of the nature of unexpected release dates and how to manage that?
Yes, thank you so much, Allie. I was getting ready to ask you to cover those questions. I saw them as well. So great questions. And we understand from our county partners, we've done a lot of stakeholder engagement with sheriff's offices and county correctional facilities and youth correctional facilities throughout our planning process, and definitely heard this this concern for our county partners. So to help mitigate those concerns, we developed what we call the short-term model. That's section 8.2 of our policy and operational guide, that requests correctional facilities to start the 90-day services as close to intake as possible. So I really encourage everyone to check out section 8.2. I believe it starts on page 79, and it has a really nice table that outlines the timelines for the short-term model that we expect correctional facilities to look at as a reference to, you know, certain timeframes where they need to provide certain level of services. So please check out that section 8.2 on our policy guide for information about short-term stays or stays when there is no release date identified just yet.
Yeah, and I think so in most cases, you're going to have somebody who's going to be in a short period of time, less than 90 days. You may not know the release date. What we're hoping is that people can make a guess about an individual as to whether they're likely to be out in under 90 days or likely to be in for a significant period of time. And definitely if they're likely to be out in under 90 days or you don't know, start services as close to intake as possible. And sort of there are some reasonable expectations about what you can do based on various timelines in that short-term model. I think if you have good information that somebody's likely to be in longer or much longer than 90 days, then you can think about a process where you wait to start delivering reimbursed JI pre-release services until closer to when you might be able to get an expectation they're going to be released. Sydney, does that sound right-ish?
Yes, I believe so.
So we have two clarifying questions that have come in, and we can pause to do those now. The first was just to clarify whether the behavioral health readiness assessment is the same thing as the correctional facility readiness assessment. Are those two separate templates and processes, or are they the same?
So there are two separate processes and two separate templates. So of course we realize we did not release the behavioral health readiness assessment template prior to this webinar. We will share that publicly as soon as we can. But there are two separate processes and two separate templates that require different levels of information, and they have different questions.
Thanks, Sydney. And another clarifying question, this one asking, how does the CBH implementation plan differ from the readiness assessment?
So another great question. Again, for our Path Round 3 recipients, the implementation plan for behavioral health agencies is specifically tied to Path Round 3 funding. So that is more of tell us how you're planning to spend the Path Round 3 money. Tell us how you're planning to use the funding to reach readiness for the behavioral health links. Whereas the behavioral health readiness assessment is tell us how you are ready to start receiving behavioral health links and providing services. So very much related documents. Of course, we encourage you to use the implementation plan to help inform your readiness assessment. You can use your PATH funding to help start planning for and implementing these processes as well, but they are two separate documents.
Excellent. Thank you again. Just want to make sure that I'm understanding this question. I have a number of questions that are still asking. So here's one, and it relates to billing. And I think it gets at a couple of the other questions that have come in. It says, am I understanding correctly that there will be separate mechanisms for billing? Separate mechanisms for billing behavioral health links, enhanced care management, pre-release services, and specialty mental health?
Yes, there will be separate billing processes for the three different services. So Paula, I saw you come off mute. I'll go ahead and let you take that one on. I'm sure you can say it more eloquently than I can.
Yeah, no, that was a good question to pull out because I think that's right. And what will be helpful when we're able to put out the billing guidance is to sort of depict how that all works together. So I also saw questions in the chat asking about whether pre-release assessment would be billable, for example. And so we'll try to say this clearly and then others jump in, but there will be a set of pre-release services that are covered and billable through Medi-Cal, but not necessarily through specialty mental health or the short Doyle system, right? And so the correctional facilities are responsible for determining how those services will be provided, and may arrange with county systems or other providers to deliver and bill for those pre-release services. And then we also have some limited service activities that we're talking about in the context of behavioral health links. And that includes that professional to professional clinical consultation or warm handoff. That will also be a billable service, but may be billed differently than the array of pre-release services that the correctional facilities are responsible for arranging for. And similarly, ECM, which is post-release, will be billed in the way that it is today, but others may want to chime in further on ECM.
Thank you so much, Paula. Megan, do you want to talk about a little bit about ECM and how managed care plans bill for that service or those services?
Sure. So ECM is provided through the managed care plans, and they're contracted to provide the services through the managed care plans, which means they're under the capitated rate structure. So they don't bill fee for service or through short Doyle like you guys may be familiar with. So it's a separate process. As far as pre-release services go, all pre-release services will be billed fee for service. The behavioral health agency receiving a behavioral health link may bill through short Doyle, and that is the only exception in the pre-release period.
Thank you.
That was even clearer than what we had previously said. Thank you, Megan.
I love it. We're all just tag teaming. I appreciate it.
Thank you, Megan. Megan, I might have another one for you. Maybe. Let's see. We have a question that came through the Q&A box that says, many individuals are released at midnight. What is the responsibility to pick up a client at midnight?
I don't know if I have like as concise of an answer as what I just gave. Honestly, our guide states that it is a best practice that they are met upon release. And so that is what we are sticking with, that it is a best practice that you would arrange to meet them upon release. I believe at this time, DHCS does not have an expectation that you are meeting them at midnight.
Thanks, Megan. I'm going to take just a couple more so that we can save some time for wrap up and a look ahead at what is coming down the pike. A follow-up on one of the questions that you'd already responded to, Sydney, is there a document that provides more input or guidance on the County Behavioral Health Agency implementation plan?
So if that's regarding the Pathron 3 implementation plan, you can definitely reach out to us to set up a TA meeting with you and your county. The document that we usually refer to is our guidance memo that was released, I believe, in September of 2023. I'm happy to have you reference that, but you can also reach out for a TA meeting with my team and our consulting group PCG, and we're happy to answer any questions during that TA call as well.
Great, thank you. Just checking to see if there are any other that we have not yet covered. There are a number, but I think some of them overlap. And just with an eye on the clock, I'm going to suggest that we take these few questions we haven't covered back to allow some time for our wrap up. But thank you so much to everyone who has submitted questions today. These were really, really thoughtful questions, and we'll be sure to take them back and provide responses to those we weren't able to cover today. Thanks, Sydney. We're in the hot seat there. I'm going to turn it back over to you.
Thank you. I know I had to turn off my space heater because it got so warm in my seat. No, thank you so much, Ali, for helping facilitate that as well. So looking ahead, so DHCS will continue to offer technical assistance to county behavioral health agencies in the coming weeks and months as agencies complete their readiness assessment template, which is due by April 1st of 2024, as they prepare to go live for behavioral health links on October 1st, 2024. So like I mentioned in the last question we have for Q&A, please reach out to us if you need any technical assistance throughout this process. We are here to help you. We want to see all of our county behavioral health agencies succeed in this process so we can make the Justice Involved Initiative as successful as it can be. So next slide, please. With that being said, thank you to everyone who attended today and to all of your for all of your insightful questions. We really recognize that this is a very complex initiative. We're the first state in the country to do it, which is great, but it also, can make it even more complex to implement. We don't have a blueprint, a model to get this work done. So we definitely understand, that this takes a lot of work to implement this, and it takes a lot of coordination. So we definitely appreciate your time today. Please reach out to us at the email address listed on the slide, CalAIM Justice Advisory Group at dhcs.ca.gov. That goes directly to my team. We manage it personally, so it's not going to go into an ether or a black hole anywhere. We will definitely respond to you if you have any questions. And please also visit our webpage for more information about the Justice Involved Initiative. So thank you again. And with that, I think we're good to close out. So everyone enjoy the rest of your day. Thank you so much for your time.